We cannot end the pandemic if the largest part of the global population has no access to vaccines. Hello, my name is Liselotte van Hensbergen and I'm a master's student in supply chain management at Tilburg University. I just finished my master thesis at Logistics Community Brabant regarding the last mile distribution of COVID-19 vaccines in low and middle income countries, with focus on improving supply chain coordination in order to improve supply chain performance and in turn the coverage rates. I'll tell you more about my research in this clip. In order to provide new insights in how supply chain coordination can be improved in order to improve supply chain performance, a qualitative exploratory case study was conducted, meaning that data was collected by qualitative methods, such as interviews with professionals in the field. Together with literature, mechanisms for effective coordination in the last mile COVID-19 vaccine supply chain in low and middle income countries, also known as LMICs, have been identified. The disturbances that affect this coordination and how this in turn impacts supply chain performance, according to the supply chain organization of the last mile. First, it is important to clarify the context of the research further. Once vaccines arrive in LMICs, low and middle income countries, the Ministry of Health or the Central Medical Store manages the vaccine distribution up until district stores, where stores is equivalent to warehouses. The last mile, which covers the part from district stores to health facilities, can be managed by the public sector, such as the Ministry of Health, or the private sector, by a local logistics service provider, LSP. Regarding decision-making, decisions can be made centralized by one central decision-making authority based on national data, or decentralized by local entities based on local data and/or local interests. Furthermore, supply chain coordination can be applied through information sharing, information technology or systems integration, joint decision-making and supply chain contracts. From the empirical findings, explanations could be derived which explain the empirical problem well. One of the explanations, which was mentioned a lot, can be seen on the slide. It starts with 3 disturbance factors which impact supply chain coordination and in turn supply chain performance. There is a lack of electronic data collection tools. Supply chain or health facility staff often do not know how to report data in the information systems, and there is a shortage of staff at health facilities, since they need to handle and report vaccines beside their regular tasks. This leads to slow data entry, which in turn leads to inadequate reporting of data, especially regarding stock status, which together with limited data quality monitoring lead to inadequate information on stock utilization, which in turn result in ineffective replenishment of vaccines and vaccine wastage, resulting in vaccine stockouts. From the empirical findings, it occurred that especially information sharing and information systems integration are crucial for enabling effective supply chain coordination in the last mile COVID-19 vaccine supply chain in low and middle income countries, and is applied to a certain extent, which is partly caused by the disturbances that arise. One of the main root disturbances is namely the lack of labor force quality, such as quantity, capacity and skills, of especially the health workers at health facilities for proper vaccine handling and information reporting or information sharing by using information systems. Another important disturbance is the infrastructure, as electronic data collection tools are scarce, as well as monitoring tools and adequate vaccine handling equipment. Moreover, internet network issues occur regularly. These disturbances especially occur in the public sector managed last mile, as LSPs, on the other hand, are more skilled and have adequate vaccine handling and information reporting equipment. On the other hand, information flow network disturbances occur in last miles that aren't completely managed by the Ministry of Health, such as in a private sector managed last mile or with technical support from NGOs, such as UNICEF, as multiple information systems are used in parallel, which complicate information sharing and alignment for adequate decision-making. Furthermore, in a centralized approach, decision-makers often lack operational knowledge. In a decentralized approach, central management control with clear procedures and responsibilities for coordinating the last mile end-to-end is lacking. The main result of inadequate supply chain coordination are vaccine stockouts and/or overstock due to ineffective replenishment of vaccines. Several recommendations follow from the findings. First of all, in case of centralized decision-making, operational knowledge should be shared by lower levels with central decision-makers in order to enable more adequate decision-making. Moreover, a central coordinating party is needed in a decentralized approach, which clarifies procedures and responsibilities, which enables more end-to-end visibility. Furthermore, especially in a public sector managed last mile, technical support should be provided by NGOs regarding adequate equipment for vaccine handling and information reporting, which already have been provided to a limited number of LMICs, and workers at lower levels need to be retrained in vaccine handling and information reporting. Finally, when NGOs or LSPs are involved in the last mile, one information system should be used to simplify information sharing and alignment. In addition, in general, data entry is crucial, especially stock status reporting. So when network issues occur, temporary solutions should be applied, such as sharing aggregate information and/or developing a temporary offline register. I would like to thank my supervisor from LCB, Albert Mandenmakers, for his feedback and guidance during the whole research process. Besides, I would like to thank my supervisor from Tilburg University and the interviewees that were willing to share their knowledge. If you're looking for more information regarding my research or if you're interested in reading my thesis, please contact LCB. Thank you very much for your attention.